Dear students, welcome to the Ocular Therapeutics module of the Specialization in Anterior Segment and Contact Lenses. In Section 1, Fundamentals of Ocular Pharmacology, we will cover the following topics: ocular pharmacodynamics, variation in drug response, mechanisms of action, receptors and G protein, ocular pharmacokinetics, ocular biopharmaceuticals. One of the fundamental concepts in ocular therapeutics is pharmacodynamics, which refers to the binding of a drug to a receptor resulting in a pharmacological effect. This effect may vary depending on the receptor affinity and the amount of drug used. It is therefore necessary to consider the relationship between the administered dose of the drug and the effect obtained as a response. Determining the right dose depends on two factors: pharmacological potency, the relationship between the effect of a drug and its concentration, and the maximum effect, the capacity of a drug to produce an effective therapeutic response, determined by its affinity with the receptors. The ideal then is to find a dose at which a maximum effect is achieved with an effective concentration range, which will allow establishing a safety margin for the drug. Variation in drug response: the pharmacological response can present variations, so a patient can be hyperreactive or hyperreactive to the drug. This depends on whether the intensity of the effect of the dose is lower or higher than that observed in most patients. This may be determined by genetic variations in their metabolism or immune mechanism, and may also depend on the physiology and anatomy of the patient. Mechanism of action: the effect of a drug depends on its interaction with the receptor in the organism. Considering the above, receptors formed by specific proteins regulate transport mechanisms, signal responses, and generate a specific response through different types of interactions with drugs. The action of physiological receptors is to propagate a response signal to a stimulus through the transduction of extracellular signals into intracellular messages to control cellular function. Receptors and G proteins in the eye: there are extracellular receptors that induce an intracellular response through the activation of the G protein located at the cytoplasmic level. This is achieved through specific molecular and biochemical mechanisms. In the human eye, the role of G protein is important because it acts on ciliary processes to generate aqueous humor. At the retinal level, G protein plays a fundamental role in phototransduction by generating bonds with vitamin A, resulting in the conversion of luminous stimuli into images. To conclude, receptors or G proteins function as chemical molecules for hormones, neurotransmitters, and substances such as histamine, serotonin, bradykinin, among others. Pharmacokinetics comprises the study of the processes of absorption, distribution, metabolism, and elimination of drugs. At the ocular level, the drug absorption pathway is through the conjunctival epithelium or corneal epithelium. The active ingredient is distributed by transconjunctival or transcorneal absorption, generated at the transcorneal level. The aqueous humor accumulates the drug and distributes it to the intraocular structures or through the trabecular meshwork to pass to the systemic route. Metabolism of the topical drug is carried out by enzymatic biotransformation. Finally, it is eliminated through the kidney or liver after being absorbed systemically. Ocular biopharmaceutics studies the absorption of the active ingredients used ophthalmically, its actors, bioavailability, partition coefficient, the factors that condition it, physicochemical properties of the active ingredients and excipients, as well as physiological factors. Bioavailability is the ability of an active ingredient/excipient to cross the ocular membranes in a given time frame at a specific concentration to exert a localized therapeutic action. This process is influenced by physiological factors such as blinking, tear volume and drainage, corneal lipophilic/hydrophilic duality, and conjunctival and scleral vascularization. In addition, the ideal drug should have a simultaneous lipophilic and hydrophilic affinity, which favors its absorption through the ocular media, referred to as the partition coefficient. This will be low or high, depending on the tissue to be intervened. It must also have a pH similar to that of the tear film and an appropriate chemical structure based on the target tissue, lipophilic or hydrophilic.
Universidad Santo Tomás, institución vigilada por el Ministerio de Educación Nacional.